Optimal Health family. Welcome to our August monthly guest speaker webinar. I am very excited for this episode because I get to interview my colleague and my friend Tara Farajian. So she is a licensed clinical social worker and has been a therapist for 20 years working with children and families, but for the last 15 years has been specializing in perinatal mental health. So this is a topic near and dear to my heart as a mom and as a physical therapist that works with lots of moms. I really look forward to having you here today, Tara.
Oh, I'm so excited to be here, Sarah. Thank you for having me.
Yeah, so for those that are joining us right now, just a few little housekeeping tips. If you don't mind muting your microphone, and you can stop your video unless you want to be able to us to see you. But if you have any questions or comments, please use the chat function down below, and we should be able to answer any questions. We'll try to do questions towards the end. But yeah, let's go ahead and get started, and yeah, let us know if you need anything. So Tara, so you've been working in this field with moms, really specializing for the last 15 years. So what kinds of mood disorders are you typically looking for or looking out for and working with in your practice?
So I think, first to just say we've made so much headway in the perinatal mental health community to really partner with providers and legislators that have put laws in place that encourage or require practitioners to screen our moms, partners. A lot of times in the prenatal phase, some symptoms and signs can already start to present. And that's the ideal. Obviously, the earlier intervention, the better, which is, I think you probably know better than I do in physical therapy. Like, as soon as there's something we can work with, let's work with it. And before it becomes maybe more intensified. So I guess with looking at perinatal mood and anxiety disorders, a lot of times the first thing people think of is, postpartum depression.
Yeah.
Right? And first of all, postpartum is you've already delivered the baby.
Mm-hmm.
And what we know is research shows that there's usually some signs in the prenatal phase that were maybe flags that if we had been attuned to, we could have put some support even sooner. As providers, we don't always get to see our patients prenatally, but it's something just to be aware of. We do have OB offices. They are most frequently using the Edinburgh scale to it's quick 10 questions to see fluctuation in mood over the past week.
Yeah.
Right? Or the PHQ-9. So those are things as well that you may even use in your practice. I'm not sure too sometimes if you're starting to see signs, or anyone who's listening or watching, it's a great tool to administer. And then also, put in referral sources if there is a high screening result.
Yeah,
So,
I think in our practice, we tend to, I think at least me as a PT, I've always expected out of personal experience too, that they do give that questionnaire for your OBGYN postpartum appointment. And so I'm expecting that is a standard of care. Do you feel that is fairly consistent, a standard of care?
It is now. It is now. It wasn't. I have a 16-year-old and a 12-year-old. So, definitely when I had my 16-year-old, there was definitely not, and even my 12-year-old, that wasn't in practice yet. So a lot of these are new developments that are wonderful to have in place. And I think to your question, kind of like, what are the things you look for? What are some of the signs and symptoms?
Yeah.
And so we know that there's the baby blues, which is really common. The stats are up to like 50 to 80% of women will experience some form of baby blues. And that's more transient. It presents maybe 4 days postpartum to 14 days. If it surpasses the 2-week mark, that's when we want to start seeking some support, outside support. What we know is those first 2 weeks, there's so much sleep interruption, adjustment in just our lives, transitions, as well as just hormonal fluxes too, as you're trying to stabilize. Your hormones continue to be in flux for a while, but as you're establishing breastfeeding, if you so choose, if that's an option for you, that too, just different hormones are coming into place. And so it could be some tearfulness, some irritability. But if it does surpass those 2 weeks, that's when you kind of want to look a little deeper.
Okay.
Yeah.
Okay. What would the differences between depression and anxiety be?
Okay. So, and that's great because usually, again, the term postpartum depression, that was used kind of universally for any symptoms you had in change of mood after having a child. But now we're aware of a lot more research where even anxiety, now that we're doing more research, we're finding that anxiety levels are often more prevalent than depressive symptoms. So moms would say, I don't feel depressed. I'm just anxious. I can't sleep. I can't, my mind is busy with thoughts. I can't, just lay down, and I can't turn off. So that's more of your anxiety symptoms. There are more specifically in terms of OCD is within, the nomenclature of anxiety. So things like OCD where there's a fear of contamination, having to wash things excessively, washing your hands excessively, and right now we're facing a pandemic. So, there's a natural level of anxiety that is going to be peaked. If you already have a propensity towards anxiety, it's likelihood for that to really creep up. Or looking at what, things to put in place to kind of reduce the anxiety or techniques. Sorry, can you see me?
Yes.
And then the other is depression, right? So depression symptoms, kind of things you'd see, lack of desire to do the things you used to do. And it's hard, you're sleep deprived, right? So there's a lot of some normalcy when you're sleep deprived of not, but if it's continuing to be prolonged, we need to kind of look at some ways to protect your sleep. Tearfulness. We also know that partners, if the mom of the family is struggling with any kind of perinatal mood or anxiety disorder, partner is more likely to as well.
Wow.
And that's research that's kind of more new to us as perinatal specialists, and that we know that male partners present very differently than our female, just in terms of how we're socialized to express emotion. A lot of times male partners may show more irritability or anger, but that's really depression.
Okay.
Yeah.
Wow.
Yeah.
So at what point do patients usually get referred to somebody like you?
So, it could be prenatally. It could be even a, a family or a mother particularly who has history of anxiety and depression and wants to be really proactive in their pregnancy, as preparing to become pregnant. Like, what are some things I should be maybe doing or putting in place now to kind of help me have the healthiest pregnancy I can, as much as in anyone's control, right? Because things are happening we don't have control over as our bodies are changing. But oftentimes, more commonly, it's a mom who is postpartum, and she goes to her OB often. Maybe it's her 6-week appointment, and she's just like, I am not myself. I don't feel like I don't even know who I am anymore. I'm crying all the time. I'm upset all the time. I can't sleep. My anxiety is, so high. And they're doing the Edinburgh now at the OB office. So they'll have a screening. They'll have a number that identifies that there's need. And then they would then be referred to my office to seek support. And I also do the free postpartum support group at Long Beach Memorial, which Sarah knows about.
Yes, that's how I met you in the first place.
Yes.
So it was a godsend for me that I had some place to go and to talk about what it was like to be a new mom and to really connect with other moms at the same stage, hear their stories, hear their solutions, hear what you had to say about things. It really was wonderful. So it's and obviously blossomed a great relationship too. So I'm very happy to have done that, and I highly advocate. That's usually if I'm talking to a friend or even patients who are having their first baby, that's one of the first things I say is make sure you find a support group, because you're really going to want it. So yeah. I try to be silent about a lot of those things, and because I know every mom kind of has to find her own way and navigating motherhood, but I really advocate for joining a group like yours when they feel ready to venture out in the world. But right now, it's you're doing it telehealth. So I mean, I don't know if that's technically the term, virtual.
Yeah, Zoom meeting.
Yeah.
Anyone can join.
Yeah. Have you found that there's been any that's been well received, or any difference in how people are interacting with you?
I mean, I learned so much from the group every time. I think, I often state that there's no better resource than another family going through a similar transition at the same time. And not that any two are exactly the same, but to find commonalities, to feel validation, like I'm not the only one feeling this, and normalizing something that can feel like just not normal at all. It's a new normal, but it's not what we're used to. So before it was in the sibling time room at Long Beach Memorial, so we'd have all together in a room. We get to see the babies and, even help each other with the babies. If, someone has to go to the bathroom, can you watch my baby one moment? And so there's a collectiveness that is just wonderful. And I definitely miss that. But at the same time, there's benefits to the Zoom, because here we have moms with newborn babies, and it's so hard to get out of the house, and find parking, and then bring the baby into the, the stroller or the carrier or and so we had, for the first time ever, a mom who Zoomed literally within like 12 hours after giving birth.
Wow.
And it was her second, so she had known of the group, but we never could have done that before.
No.
To just be witness of that moment of just she's in her postpartum. She started her postpartum and we're with her, you know?
Mm-hmm. Oh, that's wonderful.
Yeah. So there's pros and cons, but I anything that brings people together, because the other piece is the level of isolation that occurs once you have a baby.
Mm-hmm.
And I don't think, like, I myself, I had no idea. I was thinking, no, I'm going to have this baby and it's, you know, it's going to be bliss. And it wasn't. I was by myself. My son, my first, was colicky. He cried all the time,
Oh.
unsoothable. And I was behind my four walls all day with
Mm-hmm.
my baby. And that's not just, it's not good for anybody, you know?
No.
So
Yeah.
yeah, connection. We need connection. We need to break the isolation. And
Absolutely.
so I think the group is a great way to start.
Definitely.
But
Yeah.
some moms are not as comfortable to be in a group setting straight
Mm-hmm.
away
Mm-hmm.
and prefer maybe a one-on-one
Mm-hmm.
to kind of just start the dialogue of kind of what's going on, and look at some ways of caring for themselves, building their support network. And, you know, maybe it's the support group, maybe it's family, extended family, but it's support, building that support, whatever that needs to look like.
Yeah. Yeah. So what does a typical session look like when somebody's coming in after having a baby?
Okay. So, and I refer to moms because that's usually who I see. So say I have a mom come, well, right now everything's virtual, it's all telehealth, but on a traditional situation, they'd come into the office,
Mm-hmm.
um, and really just kind of giving space to just allow them, a mom, some space to feel whatever she's feeling, meeting her wherever she's at, that there is no right or wrong in it.
Mm-hmm.
Uh, but a lot of times there's so much we're carrying as moms of how maybe we thought it was going to look or how it was supposed to look, and to express any kind of struggle, oftentimes outside the therapeutic room. A lot of times I'll have moms be told, you should be so happy you have this baby. Why aren't you just so, excited? And it's sort of like, well, just because I'm feeling a struggle doesn't mean I still don't love my baby,
Mm-hmm.
and that those two things can both simultaneously exist, and to not feel judged in that and not feel criticized in that, because it's a huge life change. In my life thus far, I'm 45, I've never experienced anything so life changing,
Mm-hmm.
or that has changed me
Mm-hmm.
as much. They're teaching us all the time. I'll tell you, the 16 and 12-year-old still, I'm still attending school by my children, and I am the student. Yes.
Uh,
Um, so I don't know. Does that kind of answer a little bit? I know
yeah. How often will you have partners come to these sessions, the private sessions? Are partners coming? Are they bringing their babies a lot of the time, or does it depend on their situation?
I leave it open to the mom in terms of, on both cases, if they want to bring baby. A lot of times if anxiety is really high, being separated from the baby is really hard.
Mm-hmm.
And it's not to push something, it's just to kind of meet mom where she is. So
Mm-hmm.
if she wants baby there, I say, you can bring the baby, and if you need to breastfeed, you need to change a diaper, baby spits up, like that's all expected and it's all understood,
Mm-hmm.
um, And if mom is in a place where she feels like, oh, you know, if I could just get that hour by myself, I would love it.
Mm-hmm.
So if they can have a support person who can stay with the baby, sometimes even in the waiting room, you
Mm-hmm.
know, that mom knows the baby's there, but just feels a little bit freer to speak more openly
Mm-hmm.
without baby in the room.
Mm-hmm.
That's an option. And what I do in terms of with partners, I usually recommend 1 or 2 sessions with partner, because the family unit is going through this huge transition.
Yeah.
And so if mom's feeling it, partner's feeling it.
Mm-hmm.
And to really just removing any blame, but just saying, how do we meet each other? How do we still show up for each other through this?
Mm-hmm.
And what that could look like for me, like what that looks like for one partner may look differently for another.
Mm-hmm.
Uh, if couple is wanting more of couples therapy long term, I would refer them out, because I'm already aligned with mom.
Yeah.
So I own a level of bias that I bring, because
Mm-hmm.
I met mom first. I've heard mom's story first. So the couples, you know, doing a couple of them,
Mm-hmm.
just to help there be understanding,
Mm-hmm.
and just normalize a lot of those transitions when a baby's born, um, and trying to encourage each partner to just show up for one another
Yeah.
and hear each other. Uh,
Mm-hmm.
and it's hard to do when you're sleep deprived, you know, hungry, maybe in pain, you know.
Mm-hmm. Yeah.
So
Yeah.
that's,
Well, speaking, just mentioning the pain aspect, obviously when we're seeing moms in our practice, they are having pain, or they're having problems with incontinence or weakness, pelvic dysfunction. So in your experience, do you feel like any of these physical things are driving some of what's going on emotionally too?
yes, definitely. And there's um, Dr. Kendall Tackett. She does a lot of research with inflammation and mood. And
Mm-hmm.
we know that when you're in pain,
Mm-hmm.
it is very like, it's going to impact your mood,
Mm-hmm.
you know. So um, so just, there's a natural correlation. So
Mm-hmm.
especially, you know, I think anytime our body is not functioning at our expectations, um, how, what does that mean to us, you know, wherever we are in our life? And um, you know, whether it's to go to the bathroom, or, you know, or can I leave the house, am I afraid to, you know, so there's an anxiety maybe that's connected to that. Then there's intimacy, you know, if I have pain and I am not comfortable to be physically intimate with my partner, how does that impact our relationship, how I feel as a partner? I mean, I don't think you can separate the two,
Mm-hmm. Yeah.
you
Yeah.
know?
Yeah, definitely. I know, and we spend a lot of time with a lot of our patients working on their um, not so much, not always just pain, but just how their nervous system is perceiving different threats, and whether that's a physical threat or an emotional threat or something going on, that our pelvic muscles can be very responsive to different where our nervous system is. And if our nervous system is heightened because of some kind of threat, then we find that the pelvic floor tends to be more overactive. So we spend a lot of time working on breathing techniques with patients, and
Mm-hmm.
mindfulness, and recommending meditation techniques to try to just bring their nervous system back down. And at times we are referring them to practitioners like you if we feel like it's not managed easily by just those techniques.
Yeah. No, I mean, even the research that identifies how our body stores trauma, like physically, right? Like, and that even, I imagine you're working with a patient, just to come in contact with that part of the body that may be storing those memories, like there's emotions that just come out.
Mm-hmm.
I mean, how often is it for you to see your patient become emotional during a session?
Yeah. Yeah.
Is it,
More
is that,
often than I think.
yeah.
Yeah.
Natural.
Whether tearful or just anxiety or fear over something that they're experiencing, and is it going to get better, or am I going to stay this way forever?
Yeah.
So yeah, we hope to empower people and give them tools to be able to use so that they know they can make some forward progression with whatever they're experiencing.
Yeah.
Yeah.
And that you create that safe place where they can even release that emotion in that moment, you know, because it's there, it's been stored there.
Yeah.
Right. So it's just not denying it, but allowing it to kind of move through in a safe place. Yeah. I mean, I think that's therapy.
Yeah.
Right? Physical therapist, mental health therapist, we're all, you know.
Yes,
Yeah.
exactly. Well, let's talk a little bit about maintaining relationships, and not even just the spouse and partner relationship, but what occurs between families, like the grandparents of the parents of the mom, I should say, grandparents of the child, the baby that's coming in, and siblings, and just maintaining good family and friend relationships as you're navigating this new postpartum period. Is there any tips that you give your clients?
Well, I think it's a learning curve, right? So particularly for first pregnancy, you know, I think what I often see, and I'm no stranger to it myself, but as we have women having children later in life, the women are more often to be quite autonomous in their way of being, you know, pursued career, you know, they're established in their career, you know, even their partner, who's their partner, they, you know, enjoy, there's not much that they necessarily depend on from that partner, in terms of like, I don't know, there's a lot of independence. So when you have a child, it's a certain level of vulnerability where it is a time where learning to accept help from others, and learning how to ask for help, which may not be a muscle that you're accustomed to using much anymore, right? So I would say being flexible as a new parent, to also give yourself that compassion to say, you're not supposed to do this alone. That's just not how it's made to be. And choosing those people that you feel comfortable to really say what you need, you know, and this is with your partner, extended family, accept help, you know, which may be a bit uncomfortable initially, or for a while, but if that means you get to sleep get a nap in the day because someone's able to just hold the baby while you go lay down,
Mm-hmm.
or take a shower,
Yeah.
or go to the bathroom, you know, right? Like if someone offers to do a food train and drop off food that first week, and this is like really just drop and go. This is not visiting. You're not hosting. You don't even have to say hi. Just leave it at the doorstep. Text me it's there. Say yes. I will take the food. You want to do my laundry? Okay. You want to do my grocery shopping? All right. You know? And so it's also for friends who maybe haven't had children too, there, or any friend is like, I don't want to be pushy to the mom, and but there's a willingness often somewhere where people are willing to show up, but it's accepting that, or opening yourself up to that is so, it's not easy. It's not easy for me. It wasn't easy. It's still not easy. But if I don't take care of my needs and my well-being, then I am not going to have much to give.
Yeah.
Either.
Yeah. Yeah. Will sometimes other family members come into the sessions, the parents of the mom, or if anything needs to be communicated in any way?
Not as much. What I really would maybe look towards is client really learning to advocate for what they need and want, and being able to find ways to communicate that to the people around them. I think, things that are sometimes struggles are, if you have a strained relationship with your mom, or you have a strained relationship with extended family, it is sometimes a new opportunity, because the relationship then can be focused on the baby, and it kind of takes some of the layers of your history and allow a new beginning. And I'm not saying that if there's any risks to your well-being or your safety, or but if there is a strain there, sometimes it's not focusing on your relationship with your mom or extended family. It's like, if we make this about the baby and we're brought together by the baby, then it can create sometimes a shift, because you can't change the past, but you could look at a new future.
Yeah, that's a great way to put it.
Right. Not easy. I mean, but there are, I don't know if you want me to talk a little bit about some of the risk factors.
Yes, absolutely.
Okay. I have some of that here, so I don't forget any, because it's quite a long list.
Okay.
But this is something, whether you're a provider and you're doing your kind of your intake, and if there is family history of depression, anxiety, that will put you at a higher risk, put mom at a higher risk particularly. If there is history of loss, a lot of times I'll have moms that have experienced a stillbirth, a miscarriage, or have been struggling to conceive. Those kind of experiences of loss and I would say trauma, that there is also some intensified emotions around pregnancy, and that those changes. If there are high risk of stress levels in the mother, also high risk pregnancy in general. So if there's preeclampsia, or high blood pressure, things like that mom is perhaps just anxious about the pregnancy. If it's an unplanned pregnancy, sometimes, and we found that most pregnancies are really unplanned. So how your mind adjusts to this new fact that you were not prepared for. If there's a special needs baby, the fussy, maybe colicky baby, substance use, if there's any strained relationship with partner, domestic violence, homelessness, limited social support, poverty or financial hardship, also adoptive families, recent immigrants, military families, really high too. I mean, in general, it's very common for families to have their babies away from their support or where their biological family is. So military families even more so, right? Maybe they're on base, maybe they're in a different country, a different state, LGBTQI families as well, single moms and teen moms. So those are some of our higher risk populations too. And I know there's probably more, but I don't have it on my list yet. So I'm just going to stick with that.
Yeah, that's a big list. Yeah. So I can understand why some of these things can be so common, unfortunately.
Yeah. And then put like a pandemic on top of it. Who wouldn't feel some level of angst? I don't, right?
Yeah. Yeah. So if we have anybody watching that is not necessarily in a postpartum state at this moment, but is having a family member or a friend that they might suspect is having a hard time, how best should they approach the individual on how to seek help?
Yeah. Well, a lot of times when the individual is in the anxiety or the depression, they're less likely to be able to self-identify because they're just so in it, right? It's like when you hold a mirror close to you, you can't really see yourself, but the more degrees separated, so a close friend or a family member often will be the first one to say, I think something's not right. This is not her usual self. So a lot of times how you approach that mom is looking at what are the resources available in your area. And you can easily do that by looking at postpartum.net. That's the Postpartum Support International. They have a warm line that you can call, and they'll be able to tell you providers in your local area and support groups. So postpartum.net. Right. And if you're in the greater LA area, we have, that's one of my training locations, and it's the, you have the, well, there's multiple here, but it's the Perinatal Mental Health Task Force. And they too have resources within the local LA area. But PSI, Postpartum Support International, and the Perinatal Mental Health Task Force, they're all intertwined. We're like a small community. So either one of those will probably connect you to whatever is local to you. So postpartum.net, that would be my first go-to. Even if you're like, I think my friend is really struggling. Let me see what these symptoms, what would, am I on the right track? And what could I do? What are some resources? Yeah. So that's a great resource. Of course, I do want to say there is a very small percentage, it's like 0.01% of moms that actually experience psychosis.
Mm-hmm.
And that's when mom is not in a rational state, could potentially be in a state where she could harm herself or others around her. And that's immediate 911. Like, it's just about safety. How are we going to get mom safe? And if you see moms identifying anything like auditory hallucinations, visual hallucinations, that's immediate intervention.
Yeah.
You know, so, and it's very rare, but of course, those are usually the ones that get the most publicity.
Yeah.
So, when people even say postpartum depression, they're like, oh my gosh, are they going to take my baby away because I have and it's like, there's like a really small percentage that are at that level of a harm to themselves or others.
Yeah.
You know, because you're sad or depressed or anxious doesn't mean your baby's in harm. You know, but there's often a lot of misunderstanding. You know.
Yeah, you're right. You do hear those kinds of stories, and I can understand that some women might, or partners might feel that they don't want to say anything because they're afraid what could happen to them or their child or their family, and how disrupted that could make things, or even feeling like, well, they're going to put me on medications and maybe I don't want a medication. And so knowing what kind of options are out there for them, that at least to start talking about it, is probably one of the most important things to do.
Yes. So do you want me to go into kind of treatments in general? Do we have a little time?
Yeah, I was looking. I don't think we have any chat questions. So yeah, let's get a little overview of what kind of treatments to expect.
So you brought up medication, right? It's often a mode of treatment, and I am not a doctor. I'm not a prescriber. So that would be something really more discussed with the OB or a psychiatrist. Sometimes primary physician too, depending on the doctors, how comfortable they are, managing medication. But that's usually one of the, in terms of looking at, we kind of look at 5 options. We look at, first is really trying to secure sleep. What can protect mom's sleep. And if mom has an opportunity to rest, baby's even sleeping, but mom just cannot turn off, like that's a sign of we need to really look at some forms of treatment, because no matter how high functioning we are, if we take away our sleep, we're not going to function well. So we, even for the mom who's pumping or breastfeeding, we want to try to get to a 6-hour block of consecutive hours of sleep.
Okay.
At least. And I know, right, as a breastfeeding or pumping mom, 6 hours is a long time. Yeah. But if we can't stabilize mom's well-being, I mean, I just put that above everything.
Yeah.
You know, so looking at ways, how do we protect mom's sleep? Who could maybe be on night duty for a few days? How to help mom find her sleep again, because the rhythms are just off. Then you want to look at nutrition, like, is mom getting enough to eat and drink and fluids, which it's hard when the days just blur together. I don't know if you remember that, right? It's like, is it morning? Is it night? Did I eat today? I'm not sure. So you need to make sure that you're getting the nutrients, and sometimes having like quick snacks like nuts or other, granola bars, and lots of water, just kind of easy to grab. And then The others, we want to look at slowly integrating some exercise. And I'm not saying like a workout in any way. I'm once you're at the 6 weeks, your doctor is saying, okay, you can start to resume some of your regular activities, just a walk, just to get out in the fresh air, vitamin D, get some sunshine, you know, trying to get that mobility, because it also helps consolidate your sleep.
Yes.
Right. So it's like if you get some of that physical activity, you'll notice you get a more replenishing sleep. You go into that REM a little bit sooner and you feel more rested.
Yeah.
But again, really talking to your physical therapist, your OB about what kind of activity is okay for my body right now.
Yeah.
So okay, then you want to look at if you want to do other kinds of like supplements. Are you continue to take those prenatal vitamins? Some doctors are recommending 2 years postpartum.
Wow.
Even,
not breastfeeding.
Right.
Okay.
There's a couple of reasons, because there's also a high likelihood of pregnancy again as well. So that's one of the reasons too. And that's that unplanned pregnancy that we mentioned earlier, because it does happen. I mean, I don't want to scare people, but I've heard vasectomies, whatever, it can happen. So, so looking at supplements, a lot of times too, when you're seeing your general, if you're feeling a continual fatigue, a lot of times checking your thyroid, if there's any history of thyroid flux, if your vitamin D or your thyroid are off, the symptoms are exactly like depression. That fatigue, foggy brain, lack of desire to do things. So knowing that your body's getting the nutrients it needs is really big. So sometimes magnesium's really a good supplement too. Your B12, kind of, and then if the fatigue is continuing, to look at like a blood workup. And then there's medications, right? And there's, you can do the more holistic supplements for mood. Some are compatible with breastfeeding, some are not. So you really want to consult with maybe a naturopath. And then looking at prescription medication too, as an option. And there are medications compatible with breastfeeding. There's always some level of risk, but there's a lot more research now, particularly on your Prozac and your Zoloft, which are two common go-tos for postpartum mood and anxiety disorders. So we know a lot more of those medications if you're breastfeeding. But again, I'm not a doctor. That's something you need to consult with your doctor about.
Okay.
And just support. You got to build support, figure out what that support needs to look like for you. Even if you're the most introverted individual, we still need connection. It doesn't have to be a big party. It could just be a phone call,
One person.
Exactly. That can fill your cup. So finding support, asking for help, accepting help. Those are some ways to really, I think, help in your care.
Wow. Well, this has been wonderful, Tara. This has been great. I'm happy to this time be able to ask you some of the questions and hear more about these things. And are there any other comments or things that you have that you feel like we should really be sharing with our viewers?
Um, I just, I mean, I'm just grateful for the work you do too, Sarah. And I think the importance of our bodies, and our bodies are what we have, you know, for the rest of our life, even as our kids go and live their lives without us.
Mm-hmm.
Uh, so how to take care of yourselves. And I know I say this when you come and visit our support group, is that it's common medical practice in Europe, France, to have all moms screened, you know,
Mm-hmm.
for their pelvic floor, potential prolapse, right? Also the tell me that other one, the with the stomach muscles when they're,
Diastasis recti. Yeah.
yes, it's just like common practice, like,
Mm-hmm.
and we're looking at a society where our women are just, you're going to be in a diaper later in your life, like that's just a given, and
Yeah.
it's not a
Yeah.
given, and it does impact your quality of life.
Mm-hmm.
And we need to take care of ourselves and each other and support
Mm-hmm.
that. So I
Yes.
I'm one of your biggest fans, Sarah. You know that.
Oh, thank you. The feeling
Yeah.
is mutual, definitely. Well, it doesn't look like we have any questions that have come up in the chat, but for anybody that is watching at a later date or on Facebook, please make sure if you have any questions at all, put them in the comment section, and we will be going through that. And if there's anything specific to Tara, we will ask her. And in 2 weeks, we will be doing another Facebook Live group and trying to follow up with any frequently asked questions or follow-up questions from this talk or the talk that we did last week on Facebook. So we will try to answer any questions that come up then. So please reach out if anybody has any questions after watching this, if you did not see it live. So
Yeah.
thank you again so much,
Thank
Tara.
you.
And it was lovely to have you.
Thanks for having me.
All right. And
Take
thank you
care.
everybody for joining in. Thank you so
Thank you,
much.
everybody.
All right.
Take care.
Bye-bye.
Bye.